Hi, Dr. Adam Davis here, and I have a teaching moment that I wanted to show you guys how cool the body is and how our mind works as it can potentially develop stress within the body, creating issues of dysfunction. So the patient is complaining of tension in her upper back and neck and foot pain. So going through and checking the muscles of the stabilizing arch down here is called your posterior tibialis. So the way we test that is we have the patient bring the foot down and in. Hold the foot down and in. And as you can see, she can't do that. There's no strength in these. So bring your foot down and in, hold tight there. Okay, so neither one of those are functioning. Now we know those are associated with the adrenal glands, which secrete cortisol, especially when we're stressed. So we can see if her mind is causing any of these issues. So I'm gonna have the patient touch over her forehead. You have stress receptors on your forehead that gets activated when you're under any sort of stress. You rub these emotional points, you don't really know why you're doing it, but it helps your body deal with stress. So when she touches over her forehead, we can check these muscles again to see if they work any better. So I'm gonna have her bring her foot in, hold tight, and they immediately strengthen up. Bring this in, hold tight. Good. So we know the dysfunction that she's feeling in her feet are actually coming from her mind. So I'm going to have her think about a stressful situation. Okay, so we're going to test a strong muscle. So we're going to use her TFL here. Press out towards me. Good, nice and strong. I'm going to have her think about whatever is stressing her. So I just want you to close your eyes and focus on whatever you're stressed out about. And we're going to see if it changes the function of her body. All right, so we're going to bring this over and test it again. Press out towards me. And it immediately weakens, okay? So anytime you think about stressful thoughts, it changes how your body works. So I'm gonna use an acupressure technique to figure out what I need to fix on her. So as she keeps thinking about it, I'm gonna tap on this acupuncture point that's related to your adrenal glands and stress, and we'll see what that does to her body. So we're just gonna retest this muscle. Keep thinking about what you're thinking about. Press out towards me, and it fixes it. Okay, so let's get a range of motion on her. Clear your mind, don't think about anything. Okay, so we're gonna see on this side here, right about there, would you say? About 90 degrees, 85, 90 degrees. We'll come over and check this side. Oh, there's a big discrepancy there. This is about 110. Do you have a good hip, bad hip, good side, bad side?
My right side's
okay, the right side seems to be worse, okay, and it's less, we get less stretch of it. So let's correct this and see if it normalizes her neurology. All right, so I'm gonna have her touch over her adrenal glands because these muscles are associated with her adrenal glands. And I'm gonna have you close your eyes and think about your stress. So as she focuses on that, I'm gonna do a little technique called injury recall technique, where we reduce the tension in her nervous system. I'm gonna tap on some of these head points as she's thinking about that. Okay, cool. Let's see if that's changed anything in her neurology. All right, so we're gonna clear your mind. Clear your mind. All right, so we're gonna recheck this muscle. It was strong before. Press out towards me. Still strong. Think about what you were stressed about. You got it in your mind? All right, think about that. Press out towards me. Doesn't weaken her. Awesome. Okay, go ahead, clear your mind. Now let's see if that fixed the dysfunction of the ankle muscle here. Bring your foot in. Hold your foot in, don't let me pull. That's rock solid now. Bring this in. Press in for me. Awesome. See, I didn't even touch these muscles down here. I didn't have her give her ankle stabilization muscles. If we would have done all that, it wouldn't have fixed anything because the problem was her mind. So let's see if it improved her range of motion at all. So this side was the reduced side. So let's see if it's any better now. So it was there. I mean, right? Isn't that crazy? So that's why it's important to fix your mind in order to make the whole nervous system work properly. That's why you come to us, because we know these things.